Ladies and gentlemen, welcome to NPR News. I'm your host, Steve Inskeep. Tonight, we're delving into medical legal partnerships, what they have done to help people with health, and what they can do to offer help to you. Medical legal partnerships, abbreviated as MLPs, integrate both medical services and legal services. They focus on working specifically upstream to treat the root causes of health concerns. For example, MLPs have lawyers and other staff to help with concerns such as insurance, enrollment, and utilization, as well as tenant housing rights and food insecurity. While these items may not jump out at you while discussing healthcare, they are crucial for the overall well-being and population health. MLPs get their funding from charitable sources, health organizations, and the federal government through the Health Resources and Services Administration. However, despite this, many MLPs still receive inadequate amounts of funding, introducing an area of improvement that may work to improve the health outcomes of many lower-income patients. An increase in the funding received by MLPs could have numerous positive implications, including improving health outcomes. To talk about MLPs in a clinical setting, please welcome our first guest, Dr. Smith, an internal medicine physician over at Seattle Children's Hospital.
Thank you, Steve, for that wonderful brief and introduction. My name is Dr. Maria Smith, and I'm an internal medical physician at Washington Seattle's Children's Hospital. And I can confidently say that our MLP has been invaluable to my profession, health, and happiness. My focus as a physician is to provide high-quality care to as many patients as possible. And with the changes in our managed care policy implemented by our MLP, over 40 days of patient hospitalizations have been avoided. This lets me see and impact more patients. Someone always needs help, and now I can offer more. Actually, my good friend in the sleep clinic had more than 24 hours of her time saved annually because of the MLP's patient advocacy services. That's a crazy amount of time to have, especially as a physician when every second counts to help someone. Another aspect of my job is talking with insurance companies about my patients' coverage and prescription plans, and this is one of my most dreaded tasks. Talking with the insurance takes valuable hours out of my day, and this is time that I could have spent with patients to help improve their health. But thanks to our MLP's advocacy, they gained approval for previously denied medications, allowing me to prescribe my patients their needed meds without wasting my blood and sweat talking to those insurance companies. This is all with my current job, but in the past, I worked in a Veterans Affairs MLP in Connecticut, and this is when I first truly realized the impact of these medical legal partnerships. Our MLP was part of a study assessing the health outcomes of veterans who came to our facility. The study found that veterans who received full legal representation displayed reduced hostility, paranoia, and anxiety. This positive trend in their health continued to improve with time. Our patients' mental health improvement was also accompanied by better housing status and total income, thus increasing their long-term well-being. As a physician with repeated interactions with my patients, I could clearly see the improvements in their mental health and well-being. This study just confirmed my thoughts, and it helped me realize the true magnitude of this effect. All this is to say that MLPs are invaluable, yet unfortunately they're still underrated. Their services have been a blessing to me over the years, allowing me to preserve my mental health and interact with and help patients, which is the whole reason why I became a physician in the first place. If you had to remember one thing about this whole discussion, remember this. MLPs are the future of healthcare, and we have to do whatever we can to make sure that there are more of them.
Great. Thank you so much, Dr. Smith, for that. It's great to see the influences of MLPs on both patients' health and physicians' health, for that matter. We also know that rising healthcare costs is of an important concern right now. To talk about the financial impact of MLPs, please welcome our next guest, the Chief Financial Officer of Seattle's Children's Hospital, Suzanne Basile.
Hey, Steve. Thanks for having me. As the CFO, I work closely with our hospital's financial statements. The impacts that MLPs have had go beyond the direct positive assistance they provide our patients. MLPs have benefited our hospital from a financial standpoint as well. The legal services that our MLP provides has helped to decrease the magnitude of uncompensated care by working to address issues of social drivers of health and legal needs of our lower income patients. If a patient needs care, our team does everything we can to help, regardless of their ability to pay. However, this can lead to strain on our pockets and our capacity to see more patients. By MLPs helping patients get enrolled in insurance plans that they're already eligible for, like Medicaid, we have been able to have crucial funds to keep the hospital running. The MLP also ultimately reduces the quantity of emergency visits. Emergency visits tend to be more expensive because ER departments are very expensive to run. So not only does our MLP keep our patients out of emergency situations, but it also avoids great costs on the part of the hospital. Additionally, the length of patient hospitalizations was greatly decreased as a part of MLP's intervention, saving our physicians a significant amount of time, which allowed our hospitals to serve more patients. MLPs also work to expand the eligibility requirements for various treatments, furthering the access to care and amount of patients we were able to treat in a given time. Overall, our annual financial report looks better than ever. The Seattle Children's Hospital was able to generate an additional $500,000 during the 2015 through 2017 fiscal years with the help of MLPs.
Thank you for that great financial insight, Mrs. Battil. It's great to see that MLP initiatives are not only helping Americans be healthier, but also helping alleviate healthcare costs. At the end of the day, medical legal partnerships focus on individual patients and the specific obstacles that they face. Accordingly, we had the chance to speak with one of our community members who has greatly benefited from MLP. Please welcome Paulette.
Thank you for the introduction, Steve. Once again, my name is Paulette and I live in a small apartment complex. For years, my air conditioner had been broken. I asked my landlord about it time and time again, but he never got around to fixing it. Unfortunately, my fixed income does not let me move to other housing. When I went for my annual physical, I complained about my asthma flare-ups getting more and more rampant. My physician asked about my housing status and realized that the mold buildup from the broken AC was possibly making my asthma worse. I was connected to a medical legal partnership who sent notices to my landlord and finally convinced him to acknowledge my rights as a tenant and fix the AC. Thankfully, my asthma has become more stable without the need of excess medication. After this great outcome, I referred my friend to an MLP when her immigration status left her unable to be discharged from a hospital. The MLP helped her get a B2 visa, which reduced her hospital stay by 30 days and allowed her to be discharged safely. Not only was her hospital bill lower, but she was also able to return to her normal life. If there are legal issues impacting your health, whether it be poor quality housing, food insecurity, or something else, I urge you to contact an MLP and get the help you deserve.
Thanks, Paulette, for that valuable insight into your perspective. I guess you know where I'll be if I have any legal health concerns. After hearing all these personal and important experiences, the importance of MLP seems to be stronger than ever. So folks, here's what we need to do. First, we have to advocate and urge our government officials in the Centers for Medicare and Medicaid Services and the Health Resources and Services Administration for additional funding. The current median annual budget for MLP is around $100,000. So additional funding should offer great financial support. Of course, the exact monetary support will vary based on each program statistics, for example, the average number of patients served, yearly budget, and future goals. But the aim is the same throughout. Allow MLPs to expand their services to support patient populations better. Second, to encourage healthcare facilities to adopt MLPs and thus enable the CMS and HRSA to promote greater patient outcomes cost effectively, the CMS and HRSA should consider offering tax benefits and additional accreditation as incentives. This will establish 3 goals. 1, established MLPs will have more money to improve their services. 2, the CMS and HRSA will inevitably save money through MLPs by emphasizing value-based care and long-term health. And third, more facilities are incentivized to adopt MLPs to reduce costs and as well as increasing revenue. Ultimately, the benefits of MLPs have been proven time and time again. Yet the reach does not reflect this. To bridge this gap between potential and reality, we have to advocate for greater funding and incentives for MLPs. We have the knowledge to improve patient care and enhance well-being. Now, we just have to advocate for the means to get us there. Let's make this happen. Okay, everybody, that's all for today. Thank you for tuning into this special segment about medical legal partnerships.